Hello and welcome, everyone. It's so nice to have you here at our 2021 National ALS Association Virtual Advocacy Conference. And I want to just thank you for joining us for this 3-day experience we're going to have together. My name is Colleen Balas, and I am the president and CEO of the ALS Association. And I'm just so thrilled to have so many people here. So we have a jam-packed agenda, some really great speakers, and most importantly, you. You might feel like you're alone in your house, but really you are with nearly 900 other people joining us from around the country. And this conference just continues to amaze me. It's the largest gathering of people living with ALS and their loved ones. And right now you are virtually sitting alongside nearly 500 people living with ALS and their caregivers who are here to join us for the next few days. So as we get started, I just want to take a moment to really acknowledge our sponsors for this conference. And this isn't just a thank you, it's thank you because we couldn't do this work without you. And that is something that is so important for us to meet our mission, to meet our goals, which we're going to be talking about throughout these 3 days. So first, I'd like to thank our gold level sponsors, which are Alexion, Amylyx, Biogen, Biohaven, Genentech, and the PerMobile Foundation. And I'd like to thank our exhibitor level sponsors, Apellis, Clean, Mitsubishi Tanabe Pharma America, PRC Solito, and Solio Health. Thank you all so much, not only for your support, but for your partnership as we really try to focus on making ALS a livable disease and eventually curing it. So with that, I would like to turn the virtual microphone over to Kathleen Sheehan, who's our Vice President of Public Policy, and she's going to walk us through what to expect over the next few days. Kathleen?
Thanks so much, Colleen. It's just terrific to be with you here today. We have a fabulous program. Every day of our conference will focus on a different area, and that's going to make the connection between our strategic plan and our advocacy efforts at the ALS Association and our work with you. Today's focus is finding treatments and cures. We're going to have some important conversations, and we're going to look at the role of advocacy in helping us with our new 2030 goal and our strategic plan, how we're going to accomplish it through advocacy. We're going to take a look at our public policy priorities so you will know what Congress is looking at and what you can do. There is one housekeeping note I want to give you. Please hold your questions as you think of things you want to ask. Write them down on a piece of paper or put them someplace where you're going to remember. And at the end of our session, we will have an open Q&A panel where you can ask your questions. Thanks so much, Conley. I'm going to pass it back to you.
Great. Thank you, Kathleen. So hopefully by now you've seen that the association, we announced a goal of making ALS a livable disease by 2030. And we understand this is a big policy initiative that we wanted to take to the advocacy conference and want to unpack it, what we mean by it, what does livable disease mean, and how we're going to get there. So that way that you're prepared when you go virtually to Capitol Hill and into your own community. I know, and I know you know, that advocacy is really going to be an essential part of trying to make this goal possible. And we're gonna focus on that a lot over the next few days. So for those of you who are new to our 2030 goal, let's review that quickly and how we're going to get there. So when we say livable, we mean by 2030, people with ALS are going to live significantly longer with better quality, and that some people are even being prevented from getting ALS, including loved ones. And I know some of you may wonder, why aren't we focused on curing ALS? So I want to be crystal clear, absolutely clear. We are definitely focused on curing ALS. All the work we're going to be doing is going toward that end. Finding new treatments and cures is essential to building the pillars of that work. So we're going to talk about that in a minute. But while we search for the treatments and the cures, we need to ensure that ALS is livable for all. So how do we get there? We're going to see three essential pillars that support our work. We need to find new treatments and cures. We need to prevent or delay the harm of ALS. And we need to optimize current treatments and care. And we're going to unpack each of these three pillars in the sessions that follow, not only today, but even into the next days. So underneath those pillars, and yep, there we go. You can see that these goals of our strategic plan, this is the work that the association is undertaking over the next 3 years, all of which are critical in part of meeting our goal to make ALS a livable disease. So I kind of see this as the short runway to the long runway. We know that we're going to have to watch, monitor, and hold ourselves accountable all through the next few years, see where we're at, regroup, and then keep pushing. So our immediate priorities right now are to ensure that people with ALS have access to effective treatments and cases of ALS are being prevented. Empower people with ALS to engage in the world in the way that they want to. Reduce the physical and emotional and financial burdens of living with ALS. Ensure that all people with ALS and their caregivers receive high quality services that benefit them. And create a culture of that accountability to ensure that we're having meaningful impact for people with ALS. So you might be asking, what's my role in this? How do I really play into this? So I'll frame it out in a few different ways. One, thinking about engaging with this plan. Learn about it, question it, ask other people about it. A plan like this will always evolve, and it will take help from all kinds of stakeholders, starting with people with ALS and their loved ones. And then when you're ready, when you feel like, okay, I'm ready to engage, I want you to share this plan with other people. Get them excited, have them engage with it. And some people are going to react with skepticism, some people maybe with indifference, but we're going to keep pushing forward because people and ALS, they can't wait. And you know this. So that's how you can engage. And then we're going to get really focused on being accountable. All of our efforts need to focus on how we're helping people with ALS have a livable disease. If it's not, let's ensure it is. So we have a mantra. I've been hearing it around. I'm actually in the office today, which is a kind of a new thing. You might even see someone walk by. But our new mantra that I'm starting to hear, not only on the screen, but when I happen to be in here, is whatever takes. Whatever it takes. We are willing to do whatever it takes to make ALS a livable disease. So I'd like to show you this little video.
Oh, wait, hold on. Hold on. I'm challenging.
One summer, your support inspired a movement that helped change the world. And with it, brought fresh hope for people living with ALS. Since then, we've made progress in our fight, but there is still a road ahead of us. ALS is still a fatal disease that devastates patients and their loved ones. How do we help families who are facing the physical and emotional burdens of ALS? How do we make sure people have access to effective treatments and care? How do we turn ALS from a fatal disease into a livable one? We do whatever it takes. ALS takes everything from people and their families. So it's going to take all we've got to stop it.
So I hope you will join me in doing whatever it takes to make ALS a livable disease by 2030. So now I'd like to welcome Kathleen Sheehan back, and she's going to share our public policy priorities for 2021. Kathleen.
Thanks so much, Colleen. Well, everybody, you've heard what we plan to accomplish. And in a moment, I'm going to tell you how you can make that goal a reality by working the Hill. But I want to first take a minute to tell you what we have accomplished working together, because it's really important. and it's sometimes hard to achieve things with Congress. And so I want to acknowledge and thank everyone for what you've done so far. So together, we have ended the 5-month wait period for Social Security disability insurance for people who qualify for that. That's very big, first of all, because you get your Social Security disability check immediately, but also because you get Medicare immediately. And it's so critical that you have that, that you have the health care that you need. Together, we boosted funding for the ALS Research Program at the Department of Defense. We started off with 10 million in 2018. We boosted it to 20 million in 2019, and now we're up to 40 million, and we're going for 20 million more this year. Thank you for what you did to make that possible. We've also boosted funding, ALS funding at NIH. So we've gone from 83 million in fiscal year 2018 to 105 million in 2019. That's extremely important, and you're going to hear much more about our research program coming up later. We've also also protected access to non-invasive ventilators. And that is so important during the pandemic. As you may remember, everyone was frantic about how to get a ventilator in terms of the terrible pandemic. People living with ALS who use non-invasive ventilators needed to know that they would be able to get their machine and get their respiratory therapist. We made sure that that access was protected. We worked with respiratory physicians and with therapists, and we accomplished that. One thing that's not on the slide quite yet is that we've expanded telehealth access for speech generating devices and for swallowing support. We worked with the American Speech, Hearing, and Language Association to accomplish that. And that was accomplished by working with our ALS clinics and many others. And it's a big victory to be able to be sure that people living with ALS can get the support that they need through telehealth. I want to take a moment to tell you about our 2 top priorities this year. And everyone involved in this broadcast will be receiving on June 17th an email inviting you to contact your members of Congress. Along with that email, you will receive support, talking points for both of these bills, and you will automatically be connected to your members of Congress. And so this is why these 2 bills are so important. The first one is Act for ALS. We supported the bill last year, and we're supporting it again this year. It's one of our top priorities. Why is it so important? Because it would provide funding for access to experimental drugs and for new research at FDA to identify treatments and cures. This is critically important that we have this legislation and this new funding. I'm happy to report that many members of the House have already supported the bill, and you will be asked when you receive your email on June 17th to ask your member of Congress to support this bill if they have not already done so. The other big important ALS specific bill for us is Promising Pathways. Promising Pathways has been introduced in the Senate by Senator Braun, and it's going to soon be introduced in the House. We supported this bill last year, and we're supporting it again this year. It would create a new provisional approval pathway to accelerate access to promising treatments. This is very important for rare diseases like ALS that have no meaningful treatment. Let's go to the next slide. I want to take a moment to review all of our public policy research asks, and you'll see them on the slide in front of you. So I want to thank, first of all, folks who have helped us to get signatures for our Dear Colleague letters. So our Dear Colleague letter is really a letter from our congressional leaders to the Appropriations Committee, and it says, these are our top priorities. These letters are extremely important. On the House letter that we've been circulating has already closed. We achieved 152 signers, which is very formidable and has really helped us in past year to get our appropriations accomplishments. The Senate letter is still circulating, and you can go right now to our Action Center and send a letter to your senator asking them to sign on to the Dear Colleague letter. So here's what's in the Dear Colleague letter and why it's so important. We're asking for $130 million for ALS research at NIH. We want to continue boosting that fund. It's critically important. We've asked for $60 million for the Department of Defense ALS research. Everyone knows that ALS is much more prevalent for people who have served in the military. And we have been very focused on getting the Department of Defense to make a commitment to do this additional funding. And Congress has provided the money. I'm very happy to say that there's a lot more research being done by the Department of Defense. We're looking for $50 million for the FDA's Orphan Product Grants Program. I'm going to tell you a little bit more about that a little bit later, but I want to tell you this is new and very, very important. We're also going to be asking for $10 million for the National ALS Registry and Biorepository. The registry has many functions. One of the most important things it does is gather together research on prevention, and you'll be hearing some more about that tomorrow. We're also asking for $1 million for a National Academy study on making ALS a livable disease. This is also $1 million, not a lot of money, and we're very excited about this study, and we think it's important, and I'm going to tell you why in just a moment. Next slide, please. Let me tell you about the Orphan Drug Grant Program right now because it's up on the screen. So why is this program so important? And why do we want $50 million for this new research? First of all, the FDA Orphan Product Grant Program is a unique program. It's a proven method of successfully fostering innovative trial designs, which is so important for rare diseases like ALS. And secondly, it's unique from all the research that's done at NIH, Department of Defense, and the National ALS Registry. We really want this program. It's focused on rare diseases, and we want $50 million for ALS for this program. Next slide, please. And why is the National Academy of Sciences study important? Well, I'll tell you why. In 2006, a National Academy of Sciences study was done that convinced the Department of Veterans Affairs to declare that ALS is a service-related disease. What a transformation that made. If you're in the military and you have ALS and you come into your doctor's office and you go to the VA, you are immediately provided with an array of benefits that recognizes that your service is critical and that you got ALS because it's a service-related disease. That includes funding for caretakers, for all kinds of services and healthcare. And so why do we want this to be done again? We think the 2006 report was really monumental in making a change, and we're going to do it again. This is part of our 2030 goal to make it happen. So when we get this funding, we will be able to bring together experts from the public and private sector and develop a plan and specific policy recommendations about what Congress can do to make ALS a livable disease until we find a cure. So we are very excited about this study, and I think it's going to make a big difference. Next slide, please. Last but not least, I want to tell you about telehealth. Everyone in the audience today knows how critically important telehealth has been during the pandemic. But what happens after the pandemic? Will you be able to get a telehealth visit with your ALS clinic? That's up in the air. It's our job, and we're working with others to be sure that you do get access to your ALS clinic and any other physician through telehealth. So we're working with a large group of people to pass what's called the Connect Act. It has a very long title, but all you really need to know is the Connect Act. And here's what the Connect Act would do. It would expand access to telehealth on a permanent basis. This is so important for people living with ALS who have mobility issues, being able to get the care that you need. Now, we know how important it is for you to get to clinic and to see your doctor in person. We just want to be sure that you can also access the care that you need via telehealth. And we're going to pass legislation working with others to protect that. The Connect Act would support both patients and providers in terms of making sure that telehealth can be continued. Before the pandemic, remember, you couldn't get telehealth. It wasn't available. There's another piece of telehealth legislation that's a temporary piece of legislation, but we think it's important, and that's called the TREAT Act. The TREAT Act would extend the ability of healthcare providers like ALS clinics to provide care to patients across state lines. There are a lot of rules and regulations at the state level about who can provide care. During the pandemic, telehealth was able to wipe away all those requirements and say, if you need care and you're out of state, you can get it via telehealth. And we're working with others to be sure that that is extended for as long as possible, at least until we can get the Connect Act legislation passed. At this point, Colleen, I'm going to turn it back to you. And thank you so much to everybody for participating. And I hope that you will join us on June 17th when we contact Congress.
Great. Thank you, Kathleen. That's really good information. I know people will probably want to review that again, so don't worry. We'll have those opportunities, but a lot of really important policy initiatives that we're moving forward on. So now we're going to turn the program over to our Chief Mission Officer, Dr. Neil Thacker, who's going to talk a bit more on finding those new treatments and cures. Neil, the floor is yours.
Thanks, Colony. So if we can go to the next slide, please. I want to give an overview of how we're going to make ALS a livable disease. And I'm going to focus on one of the key pillars of how we're going to get there. And so as a summary of what Colony was talking about earlier, livable really means three things. It means living longer, living with a better quality of life, and then helping people that you know, people that you love, people you serve with, people in your family, also from getting ALS as well. And there are three key things that we need to focus on for the rest of the decade to get there. One of them is optimizing the treatments that we have right now. The other is preventing or delaying the harms associated with ALS. And what I'm going to focus on now, which is finding new treatments and cures. So if you can go to the next slide, please, Adam. I want to, first of all, thank you, everyone who's watching, because many of you have been coming to these advocacy conferences for a long time and working with others in the ALS community for some really, I think, impressive gains in ALS research, which is critical to our search for new treatments and a cure. And these are the programs that Kathleen has been talking about, put into graph form. And the ALS Association is down at the bottom. And the big gray part is the NIH. And then that blue bar at the top is the dramatic growth that we're seeing in the Department of Defense research program, which has been really important. And so that's the context we're working in. I think we need to see more growth in the research funding space. And I want to talk a little bit about how that money is spent and what it's used for. So if you can go to the next slide. This is our little working map of the ALS research space. And you'll see on the far left, we have more basic science kinds of things. What causes ALS and how ALS is working in the body and what we can, finding ways to stop it. So those are things like genes that may be causing ALS, the pathways within cells and neurons that we may be able to intervene at, and then things that may be causing ALS, such as environmental risks, for example. So we can take all that information and we can start finding ways to measure the progress of disease. Those are biomarkers. And we might be able to also identify targets for intervention. These are potential new drugs. And then we can start testing them in humans. This is the FDA jargon of phase 1, phase 2, phase 3 clinical trials. And then eventually a drug will actually get into clinic and we get into this managing ALS space. So we can think about how this drug works in the real world, how it works in combination with other drugs. And then we can think about other things which are really important for quality of life, such as assistive technology, ways to deliver services such as telehealth, like Kathleen just mentioned, impacts of ALS on families and caregivers, and what we can do to make those things easy. And the association supports all of these activities except for phase 3, which is the most expensive of all the clinical trials. They're very big. They're way out of our scale. And in general, we're supporting $50 to $60 million of research around the world at any given time. Right about now, the last time I checked, it was about 165 projects around the world. The association doesn't fund specific institutions. We fund the best science and the best people wherever they are. So if you go to the next slide, please, Adam. We have this focus, this 2030 framework, and it's really forcing us to think about what's the fastest way to get the impact we want. And there are 3 basic ways to get to finding ALS treatments and cures. And one is the basic science, to really understand how the brain works, how ALS and related neurodegenerative diseases work, and build that framework. And that's really important, and NIH does a lot of funding on that. But that takes a very long time to figure out, to take the ideas that come from that basic science and bring it all the way to people. So something that's faster is to focus on more clinically relevant, closer to human kinds of scientific activity. And there's 2 flavors of treatment. One is the breakthrough treatment, the one that results in reversals, restoration of function, the things that we really want right away. And those are hard to do. There is also the potential, though, for incremental treatments that could work in combination with each other. You may have heard this as a cocktail approach. So we work at the same time while we're looking for breakthroughs. We're looking also for treatments that have any benefit, even if it's modest, and seeing how they can work together in combination to bring them together and to help people live longer and better until we get that ultimate cure. So how do we do that? So can we go to the next slide, please? There's really 3 basic things we need to do to get to these new treatments fast. And so one is we just need more clinical trials. The failure rate for ALS clinical trials is high because we don't understand that science as well as we could if we had the decades to do that research. So we just need to keep taking more shots on goal, running more trials, running them faster. We also need more people to participate in these trials. And so that has things to do with trial design. It also has efforts we can do to help connect people to clinical trials. And that's where the National Registry, our survey program like the Focus can help. We also need research that's really focused on impact. More funding can mean more trials and more trial sites and more participants if we focus the research on those areas. We also need a faster and more effective FDA. And Kathleen talked about some programs to help do that. And there's other efforts which are a little more focused on the executive branch and the FDA itself than what's happening in Congress. But that's also a focus of what we're doing. So let's go back then. Thank you, Adam. To how getting treatments fast relates to our advocacy asks. So we're asking the federal government for more funding for research from the NIH, from the DoD, from the CDC, from the FDA. And we have 2, I think, major pieces of legislation to change how the FDA works to make it faster and more responsive. And that's the Act for ALS, and it's also the Promising Pathways Act. And let's go to the next slide. I can start to map this out for you. So the NIH supports this entire pipeline, but they're most heavily focused on the biology and genetics of ALS and preclinical discovery. And we have some examples, which we'll talk about, I think, tomorrow, of how we're pulling them more to focus even more on clinical care. But they are the major funders for biology and genetics. The CDC is the major funder for the risks and causes of ALS, and that's why that program is so important to us. The DoD is a major funder of preclinical drug discovery, and with the gains we've been making in their budget, we're also seeing them move into clinical trials, which is very important. The FDA Orphan Drug Grants Program that Kathleen mentioned gives them additional ability to fund research, not only the trials themselves, but the regulatory issues and some of the scientific questions that they have that get in the way of getting drugs through the FDA very quickly. So we're also excited about that program. And then the Act for ALS and the Promising Pathways Act focus on this end stage of clinical trial development to help people get drugs faster, to get the FDA to approve drugs faster, to get people access to drugs during the experimental phase. And then we're always working with the NIH to have them do more on research of people who have the disease, the post-clinical work, the managing ALS work. So that's the funding part of the picture. This last part is related to how we're going to coordinate all of this. There's a lot of money, a lot of agencies, a lot of bureaucracy, and how do we keep everyone focused? And so these two pictures that you see up here are from our Research Triangle review of our Ice Bucket Challenge. And the dots are the number of people who are studying ALS, and the blue lines are the connections. And you can see through that Ice Bucket Challenge spending, we have more people, more dots, and they're working more closely together. There's more lines connecting them together. So we know we can do this with a little bit of funding. We can get more people involved. But how do we keep them focused on increasing the pace for more drugs and treatments? That's where the academies can come in. They can do that agenda setting work. So when we have that done, we can get to a state where we have more clinical trials, more participation in research, more impact-focused research that's going to help lead to increased length of life, quality of life, helping delay or prevent diseases, and eventually to restore function and to cure ALS. So I want to thank you for that. We'll be talking more about this stuff, and I want to turn back to Colleen.
Okay, great. Thank you, Neil. A lot of good information there, actually from both Kathleen and Neil, kind of packed it all in together. So I'm sure a lot of people are going to kind of sit on it, think about it, marinate, and we'll have a lot of questions, I'm sure, today and even throughout the conference. So now it's time for a quick break. We are going to reconvene at 40 minutes past the hour. So that's 3:40 East Coast time, and then do the math all the way across the country. And then we're going to hear from some amazing people. So thank you all very much. Take a quick stretch, a coffee, whatever you need, and we'll see you back here at 40 minutes past the hour.